121. A patient with Addison's disease is experiencing an adrenal crisis. What is the priority? A. Administer 4-hydrocortisone. B. Encourage fluid intake. C. Monitor glucose levels. D. Give potassium supplements. Answer. A. Administer 4-hydrocortisone. Rationale. Adrenal crisis requires immediate steroid replacement. 122. A nurse is preparing to administer digoxin. What should be checked first? A. Blood pressure. B. Respiratory rate. C. Apical pulse. D. Oxygen saturation. Answer. C. Apical pulse. Rationale. Hold digoxin if the heart rate is less than 60 bpm. 123. A patient with hypothyroidism is prescribed levothyroxine. What statement indicates understanding? A. I will take this with food. B. I should take this in the morning. C. I will stop taking it when I feel better. D. I can take it with calcium supplements. Answer. B. I should take this in the morning. Rationale. Levothyroxine is best absorbed on an empty stomach in the morning. 124. A patient is receiving 4 potassium. What should the nurse monitor? A. Heart rhythm. B. Reflexes. C. Temperature. D. Urine color. Answer. A. Heart rhythm. Rationale. 4 potassium can cause cardiac dysrhythmias. 125. A nurse is caring for a patient with cirrhosis. What dietary instruction is important? A. High-protein diet. B. Low-sodium diet. C. High-fat diet. D. Increased dairy intake. Answer. B. Low-sodium diet. Rationale. Reducing sodium prevents fluid retention and ascites. 126. A patient with a new colostomy is concerned about odor. What should the nurse suggest? A. Avoid broccoli and beans. B. Increase dairy intake. C. Eat only raw vegetables. D. Reduce water intake. Answer. A. Avoid broccoli and beans. Rationale. These foods increase gas and odor. 127. A nurse is assessing a patient with compartment syndrome. What is a key symptom? A. Absent pedal pulse. B. Warm, pink skin. C. Mild swelling. D. Decreased urine output. Answer. A. Absent pedal pulse. Rationale. Compartment syndrome leads to reduced circulation. 128. A patient is taking prednisone for rheumatoid arthritis. What side effect should be monitored? A. Hypoglycemia. B. Weight loss. C. Osteoporosis. D. Bradycardia. Answer. C. Osteoporosis. Rationale. Long-term steroid use increases bone loss. 129. A nurse is caring for a patient with a chest tube. What requires immediate intervention? A. Continuous bubbling in the water seal chamber. B. Drainage of 50 milliliters per hour. C. Fluctuations in the water seal chamber. D. The patients complained of pain at the site. Answer. A. Continuous bubbling in the water seal chamber. Rationale. This indicates an air leak. 130. A patient with pancreatitis is experiencing severe pain. What is the best intervention? A. Encourage ambulation. B. Administer for morphine. C. Give a high-fat diet. D. Provide ice chips. Answer. B. Administer for morphine. Rationale. Pain relief is the priority for pancreatitis. 131. A nurse is caring for a patient with DKA. What is the priority intervention? A. Administer for insulin. B. Give oral glucose. C. Monitor hemoglobin. D. Restrict fluids. Answer. A. Administer for insulin. Rationale. For insulin reduces blood glucose in DKA. 132. A patient with a pulmonary embolism is receiving heparin. What lab value should be monitored? A. INR. B. APTT. C. Platelets. D. Hemoglobin. Answer. B. APTT. Rationale. Heparin therapy is monitored using APTT. 133. A nurse is caring for a patient who is postoperative after a knee replacement. Which is the priority assessment? A. Pain level. B. Urine output. C. Lung sounds. D. Surgical site appearance. Answer: C. Lung sounds. Rationale: postoperative patients are at high risk for respiratory complications, such as atelectasis or pneumonia. 134. A patient is diagnosed with a stroke. What is the priority nursing intervention? A. Administer aspirin. B. Maintain airway patency. C. Monitor blood pressure. D. Apply compression stockings. Answer: B. Maintain airway patency. Rationale: ensuring the airway is open is critical in stroke management. 135. A nurse is caring for a patient with an ileostomy. What should be included in patient teaching? A. Avoid high-fiber foods. B. Increase sodium intake. C. Drink plenty of water. D. Use a skin barrier ointment daily. Answer: C. Drink plenty of water. Rationale: patients with an ileostomy are at risk for dehydration due to increased stool output. 136. A patient is prescribed lorazepam for anxiety. What is a common side effect to monitor for? A. Increased heart rate. B. Drowsiness. C. Hyperactivity. D. Insomnia. Answer: B. Drowsiness. Rationale: lorazepam, a benzodiazepine, can cause sedation and drowsiness. 137. A patient with chronic obstructive pulmonary disease, COPD, is using a nebulizer for bronchodilation. What is an appropriate nursing action? A. Have the patient breathe in slowly and deeply. B. Encourage the patient to cough forcefully. C. Restrict fluid intake during the procedure. D. Monitor for wheezing after the treatment. Answer: A. Have the patient breathe in slowly and deeply. Rationale: this technique ensures that the medication reaches the lungs effectively. 138. A nurse is preparing to administer an intramuscular IM injection. Which is the correct site for the injection? A. Deltoid. B. Gluteus maximus. C. Dorsogluteal. D. Vastus lateralis. Answer: B. Gluteus maximus. Rationale: the gluteus maximus is commonly used for larger IM injections. 139. A patient is receiving a blood transfusion and develops fever and chills. What is the priority action? A. Slow the transfusion rate. B. Administer acetaminophen. C. Discontinue the transfusion. D. Notify the physician immediately. Answer: C. Discontinue the transfusion. Rationale: fever and chills may indicate a transfusion reaction, which requires stopping the transfusion immediately. 140. A nurse is caring for a patient who has been diagnosed with acute appendicitis. What is a priority intervention? A. Encourage ambulation. B. Administer opioid pain medication. C. Prepare the patient for surgery. D. Restrict fluids and food. Answer: C. Prepare the patient for surgery. Rationale: acute appendicitis often requires surgical intervention to prevent rupture. 141. A patient with chronic hypertension is prescribed an ACE inhibitor. What is an important side effect to monitor for? A. Hyperkalemia. B. Tachycardia. C. Hypoglycemia. D. Weight gain. Answer: A. Hyperkalemia. Rationale: ACE inhibitors can cause elevated potassium levels, which should be monitored. 142. A nurse is caring for a patient with an acute myocardial infarction, MI. Which intervention is a priority? A. Administer thrombolytics. B. Provide supplemental oxygen. C. Initiate cardiac monitoring. D. Give pain medications. Answer: B. Provide supplemental oxygen. Rationale: oxygen is essential to ensure adequate tissue oxygenation during a myocardial infarction. 143. A nurse is preparing to administer enoxaparin, Lovenox, subcutaneously. Which of the following is the correct technique? A. Inject into the muscle of the upper arm. B. Pinch the skin before injecting. C. Massage the injection site after administration. D. Administer the medication rapidly. Answer: B. Pinch the skin before injecting. Rationale: pinching the skin helps to avoid injecting into muscle tissue. 144. A patient who had abdominal surgery complains of nausea and vomiting. Which action should the nurse take first? A. Administer antiemetics. B. Offer clear fluids. C. Assess the patient's abdominal sounds. D. Encourage deep breathing exercises. Answer: C. Assess the patient's abdominal sounds. Rationale: assessing bowel sounds is necessary to rule out any surgical complications such as bowel obstruction. 145. A nurse is assessing a patient postoperatively after a cholecystectomy. What is a common expected finding? A. Hemorrhage. B. Right upper quadrant pain. C. Constipation. D. Bloating. Answer: B. Right upper quadrant pain. Rationale: after gallbladder removal, the patient may experience mild right upper quadrant pain due to surgery. 146. A nurse is caring for a patient who has a gastric ulcer. What is an appropriate dietary recommendation? A. High-fat diet. B. Low-fiber diet. C. Avoid spicy foods. D. Increase caffeine intake. Answer: C. Avoid spicy foods. Rationale: spicy foods can irritate the stomach lining and exacerbate ulcer symptoms. 147. A nurse is educating a patient with a new diagnosis of diabetes. What is an important teaching point? A. Limit protein intake. B. Increase potassium intake. C. Monitor blood glucose regularly. D. Reduce fluid intake. Answer: C. Monitor blood glucose regularly. Rationale: regular blood glucose monitoring is critical in diabetes management. 148. A patient with severe dehydration is receiving 4 fluids. Which finding indicates a positive response to treatment? A. Increased blood pressure. B. Increased heart rate. C. Decreased urine output. D. Increased urine output. Answer: D. Increased urine output. Rationale: increased urine output indicates that the kidneys are receiving sufficient blood flow. 149. A nurse is preparing to administer a dose of morphine to a patient for pain. What should the nurse do first? A. Assess pain intensity. B. Assess blood pressure and heart rate. C. Verify the order with another nurse. D. Administer the medication. Answer: B. Assess blood pressure and heart rate. Rationale: morphine can cause respiratory depression and hypotension, so it is important to assess vitals before administration. 150. A nurse is caring for a patient with a tracheostomy. What is the priority nursing action? A. Suction the tracheostomy tube. B. Ensure the patient is on oxygen. C. Change the tracheostomy dressing. D. Assess lung sounds. Answer: D. Assess lung sounds. Rationale: assessing lung sounds helps determine if the airway is patent and effective. 151. A nurse is caring for a patient with acute pancreatitis. What is a priority intervention? A. Administer pain medication. B. Encourage fluid intake. C. Provide a high-protein diet. D. Restrict oral intake. Answer: D. Restrict oral intake. Rationale: oral intake should be restricted to allow the pancreas to rest and recover. 152. A nurse is caring for a patient with a new diagnosis of a hernia. What teaching point is important? A. Avoid lifting heavy objects. B. Increase dietary fiber. C. Wear compression stockings. D. Perform regular abdominal exercises. Answer: A. Avoid lifting heavy objects. Rationale: lifting heavy objects can increase intra-abdominal pressure, worsening the hernia. 153. A patient with cirrhosis develops ascites. What intervention is most appropriate? A. Administer diuretics. B. Encourage high-sodium foods. C. Administer potassium supplements. D. Restrict protein intake. Answer: A. Administer diuretics. Rationale: diuretics help reduce fluid retention and relieve symptoms of ascites. 154. A nurse is caring for a patient with an infection who is prescribed a broad-spectrum antibiotic. What is the priority action? A. Monitor for allergic reactions. B. Ensure the patient is on a low-sodium diet. C. Administer pain medication. D. Assess for liver dysfunction. Answer: A. Monitor for allergic reactions. Rationale: broad-spectrum antibiotics can trigger allergic reactions, so monitoring is essential. 155. A nurse is assessing a patient with an abdominal wound. What is an early sign of wound infection? A. Redness and warmth at the site. B. Clear drainage from the wound. C. Wound edges well approximated. D. Decrease in temperature. Answer: A. Redness and warmth at the site. Rationale: redness and warmth are early signs of inflammation or infection. 156. A nurse is caring for a patient after a myocardial infarction. What is an expected finding? A. Bradycardia. B. Orthopnea. C. Elevated blood pressure. D. Chest pain relief. Answer: C. Elevated blood pressure. Rationale: elevated blood pressure is common after a myocardial infarction due to stress and pain. 157. A patient who had a hip replacement surgery is at risk for dislocation. What action is the nurse's priority? A. Maintain hip abduction. B. Encourage early ambulation. C. Limit fluid intake. D. Elevate the head of the bed. Answer: A. Maintain hip abduction. Rationale: maintaining hip abduction prevents hip dislocation after hip replacement surgery. 158. A nurse is caring for a patient with a head injury. Which assessment finding requires immediate intervention? A. Bradycardia. B. Decreased level of consciousness. C. Decreased blood pressure. D. Shallow respirations. Answer: B. Decreased level of consciousness. Rationale: a decreased level of consciousness is a sign of increased intracranial pressure, which requires immediate intervention. 159. A nurse is caring for a patient with congestive heart failure, CHF. What is the priority nursing action? A. Encourage fluid intake. B. Assess lung sounds. C. Monitor daily weight. D. Administer oxygen. Answer: B. Assess lung sounds. Rationale: assessing lung sounds helps to detect fluid accumulation in the lungs, which is a common complication of CHF. 160. A nurse is caring for a patient with a deep vein thrombosis, DVT. What is the priority nursing intervention? A. Administer heparin. B. Elevate the affected leg. C. Apply compression stockings. D. Encourage ambulation. Answer: B. Elevate the affected leg. Rationale: elevating the affected leg helps reduce swelling and promotes venous return.